problem. So, and
Okay,
okay,
sorry.
no problem.
I apologize. I'm a little bit
Running around.
running around today. It's been one of those days, so I'll do my best.
No, no problem. No problem at all.
Good. Maybe you have to edit, John.
That's right. I done that a lot. Don't worry. And we've in recent weeks, I know we've published other articles regarding people's back issues from people staying at home a lot more, and bad back postures and neck postures, and from the pandemic just being more staying more at home. But I'm wondering what specific trends you're seeing in your practice regarding back and neck issues, and as we approach World Spine Day, which tries to promote the awareness of the things you can do to avoid back and neck issues with exercise.
So,
go ahead.
Yeah, good question. So first, people are sitting for many more hours a day. They're working from home remotely in many cases now, most of my patients. They're sitting at their dining room table with poor chairs that are not really made to sustain you throughout the day, have no support in the lumbar spine. They may be putting their legs up on another chair. They're doing that. They're slouching forward. The table height, let's say they're doing it at the dining room table, the table height might not be optimal at all. So their workstation is not ergonomic. So I'm seeing a lot of that actually. What we're seeing is that, patients are sitting for extended hours at a time. And we know from research that sitting for more than 5 hours really increases the risk of low back pain. Also increases the risk of obesity, diabetes, and heart disease. But from the standpoint of low back pain, people are now spending more time. They're not getting up like they would in the workplace and moving around the workstation or moving around the office. So they're staying for hours on end. And then when they're done work that night, they sit on the sofa and they watch TV and start catching up on the TV and binge watching TV shows. So they're kind of sitting for many more hours than the usual workday. And I think that plays a role. When we first started with the COVID-19, people were getting out, they were walking more, they were going around their neighborhoods, they were exercising. With the continuing issues of isolation, I think people are doing it maybe a little less than they were. They started out good, but I think I'm seeing a tapering off of that. Gyms were also limited, in terms of what their hours. And people were also scared to go back to gyms because of the risk of virus transmission. So I think that's an issue. So they're not going to their gyms. They're doing their own stretches or workouts, but they're not always consistent. And they're sitting for many more hours. So I've seen a huge amount of increase in back pain related to all that. Plus, the other issue with COVID-19 is people have gained some weight. So now they're not in the workplace, so they can run or walk to the refrigerator or the cabinet where the snacks are more readily and take that, whereas in the workplace, they'd be a little bit more disciplined with regard to that. Right. So I think all these factors, people have gained some weight, they're more sedentary, they're not exercising in the same capacity they were before. Not that they're not trying, it's just that the opportunities are not as great for them, and they're nervous about being in public and gyms and things like that. So I think all that together has increased the risk of, and actually not just the risk, but the actuality of low back pain in my patients.
That's a great point. I mean, like I said in the beginning, I saw a lot more people in my neighborhood walking around than I do now. It's a great point. And it's tapered off. And have you actually seen an increase in basically complaints since the beginning of the pandemic, the 6 months?
I think so. We're really busy with complaints of low back pain. People are telling me they walk. Well, that's really helpful, of course, but they think that that's all they need to do. Every time I ask a patient, which I ask every patient, what are you doing for exercise? They say, I'm walking. That's fine for cardiovascular, but not fine for spine mechanics, not fine for core strengthening. And so people are sitting more and not strengthening their core more.
Right, and we know how important core strengthening is, stretching, and if you can, I know the gyms are kind of, people are afraid, but some resistance,
Yeah, so people
back
started off really well, and they were doing Zoom classes online and stuff. I don't know that I don't get the impression from my patients they're all doing that anymore. It was a real big push in the beginning. I think that's tapering off a little bit now.
Right.
The other thing is they're not getting out as much in the community, right? So people would go on a lot more errands and go around. They would go to dinner. They would go to the movies or a show or something. They're not doing that. So they're definitely overall more sedentary than they used to be.
In terms of digital devices, and I know our TextNet 4 years ago did really well, that article. I mean, are people doing more? I mean, is there more neck issues as well? And not just, you know.
Yeah, that's a great point also, a great question. I do see more neck issues now. People are using their iPads a lot more, their phones, their cell phones a lot more. Everything is moved online. So people are really, to remain connected, they are constantly on their digital devices most of the day. So yes, I think that's a great point.
And is the age range changing? I mean, are you seeing as many young people, or middle age, or older?
I think it's a mix. I think the older people are definitely more socially isolated now. And that brings up a good point. With social isolation, that enhances the pain factor. So they may have had underlying degenerative disc changes or spinal stenosis or the common things we find in the elderly age group. However, they're not getting out now. So socially, they're isolated. They're not seeing their families as much. Their families are a little bit still afraid to go visit them. So they feel isolated. So you start to reflect more on that pain. You start to somaticize a little bit more on the pain because you're not going anywhere. You're not seeing people. Anxiety with the COVID situation enhances pain. Depression over what's going to happen in the future increases pain. So all these are really strong psychosocial factors that influence pain. And it's not saying it creates pain, but it perpetuates it in a much higher degree. And we tend to underestimate the psychosocial factors involved with low back pain and neck pain. They're very strong. So if you feel good, your posture changes, you open up when you're standing and walking. But when you're depressed or you're anxious, you tend to kind of go into more of that fetal position where you're bent forward, which puts more strain on your back. Your arms, I don't know if you want to see any of this start video, but your arms are more forward, and so you're kind of like hunched over more. Whereas if you're in good spirits, you're more, relaxed, you're more open. But I see a lot of people more like this, and that goes along with the whole thing: the sitting for long periods of time, the social isolation, the depression, and the anxiety.
That's somebody else.
This is my office calling. Can I just
go
take
ahead.
this with?
Please go ahead and mute off.
Fulchin. Okay, I'm doing an interview right now, so I'm sorry. Try to call her on her cell. All right. Okay. Oh, she was in this office earlier. Okay. Thanks, Catherine. Bye-bye.
Oh, that was a great point.
Catherine's I'm doing an interview. Catherine's trying to reach you from the other office. Catherine Godoy, or wherever she is. Okay.
That was a great point, Doctor, on isolation, especially maybe older folks, which may just aggravate this if you have issues. It just aggravates them. It makes them worse with maybe back or neck issues. Did you want to add anything to that, or younger people maybe are they more of the digital device TextNet?
Yeah, I think that's more of the TextNet with them bending forward, looking down all the time, and getting neck strain from that as well. I think that I see a lot of that. And again, they're not as active. They're not going out as much. They're not socializing. They don't go dancing even. And those are factors that younger people would go dancing and go to clubs and things like that. They're not doing any of that. So I think overall movement is less. And I know World Spine Day. I guess the message is, trying to get people more aware of posture and exercise and weight management and what they can do for
for improving spine health. But I mean, is there a message that you want to, a short kind of message on in terms of World Spine Day you want to put out to people that are going to read this?
Yes, I think so. I would say, in reflecting on World Spine Day and the issues related to neck and back issues or neck and back pain, we have to be aware that we still need to move. The body is meant to move. We need to not lose track of that. And although we have become more isolated working from home, we need to make sure our sitting posture is good, our ergonomics at the workstation that we've developed at home is good, that we continue to get fresh air as much as possible and walk, but also do some core strengthening exercises. I really feel that studies have shown that one of the best things for back and neck pain or spine related issues is core strengthening, and we need to make sure that we're doing that on a regular basis and not just walking, but doing core strengthening, keeping our weight down to as close to ideal body weight as possible, because it's important to keep in mind that excessive weight gain will put a lot more strain on the back, and it's not a 1-to-1 ratio. It's actually a multiple factor. So for every pound of weight in the front that you're carrying around, it can be up to 10 to 30 fold increase in pressure on your low back. So that's important to keep in mind. So just losing the weight or not gaining it in the first place are all factors I think are really important here.
Fantastic. As always, very, very, very great information. I don't know if Gabby, what you want to add anything, or David?
Yeah, a couple good anecdotes that Gabby mentioned to me that I think you had mentioned that could be relevant for the blog. I know you. Is it true that it's the number one cause, back pain that is the number one cause to see a physician after the common cold?
It is. It's the number one cause of seeing a physician after the common cold in age 45 or younger.
Yeah, I mean, I assume that might have even increased in the wake of COVID.
I don't keep individual statistics on this, but it certainly seems like it has increased. I'm seeing more younger people with low back pain. I've always seen the elderly folks with low back pain due to degenerative causes, but the younger folks now, I think, are definitely more common as well.
And I think this is almost the ironic fact. I think you've also mentioned it's the most common reason people call out of work. And now we have people working at home. So it's almost as if working from home is making the problem that already existed worse. It kind of sounds like.
Yeah, exactly. In fact, I saw someone just before this call who was working from home and called out of work from home over the last week because of back pain. She said, "Do you think I should continue to take off?" And I said, "No, you're already home. Why don't we start treatment that's appropriate? You could do this at home, but I don't think you should stop working. I think you need to keep your mind busy, and you certainly can do this in a correct way." I also would say, I've said to more people lately that if you're working from home, get a standing desk set up at home, because I think that would give you ability to change position throughout the day, stand up, and constantly keep moving and changing position. I tell people to take a break and drink some water, keep hydrated, get some fresh air, come back in. People forget they can do all these things when they're working from home, and they still have an easy avenue to leave the computer for a few minutes. But what happens is they forget, they get involved in their work, and 1 hour leads to the next, and they find they're sitting for long periods of time, and then they're not incorporating that exercise that they need.
Great information. Thank you.
Thank you.
You're welcome.
Gabby, anything from you? Or?
Great questions.
I think that was perfect.
Yeah, I think it's
Okay.
great. As usual, Doctor, thanks again. And when I write something up, I'll send it your way, or Gabby will, and
Okay.
we'll shoot for publishing the 15th or the 16th for World.
Okay. So what's the next step? The World Spine Day is next week, right? The
Right.
16th.
Right. So
We're doing this as a blog.
yeah, well, it's a blog, and then we'll put it out the morning of the 16th on all our social media platforms.
Okay. All right.
To remind people.
And then,
yeah, go ahead, Gabby.
oh, sorry. And then in addition, that's probably what you're wondering. The Instagram Live, topic. That was like the second part that we were doing for World Spine Day. So I'm working with our social media team now to figure out who the host is going to be. I'm not sure who it will be, but that person will just ask you questions via Instagram Live, and then you answer them.
Okay.
The topic would be the same as what we just discussed right now.
Okay.
And then someone from our social media team would go to your office to help you log into the Instagram, and they'll handle all the logistics. So all you have to do is wear your lab coat, and then it's really, really simple. Just like
Okay, so that's next week also, the 16th, or?
it'll be the 16th. I don't know what time it's going to be at just because we don't know who the host is. So we have to wait until we confirm that. But Melanie said she put a block on your schedule that morning because it was an admin day anyway.
All right, perfect.
Hopefully I'll give you an answer about the time by end of day today.
Okay,
And then Dr. Tocha, on our end with media, anything we're going to pitch this as well. Same topic. So anything we secure, if they're interested in interviewing you, we'll make you aware of that.
okay. Also, Gabby, to let you know, I'm going to get my picture reshot. My profile
Yes.
picture is different than how I look now because I've lost a lot of weight.
Yes, I think I spoke to Michelle from your office. I think it was
Yeah.
Michelle who said she was coordinating the new headshot.
Yeah, so I'm going to try to get that done Friday.
Perfect. So once we get that new headshot, we'll make sure to use that one on the blog instead. John, I'll send it to you.
Oh,
Okay.
sure. Oh, yeah, please send me the new
All right.
photo. And,
Will do.
well,
All right, guys.
Thanks again, Doctor. Appreciate it. We'll be in touch.
Thank you so much.
All right, you're welcome.
Take
Thank you.
care.
Bye-bye. You too.
Bye. Thank you.
Bye.